Hi everyone, I'm Dr. Roman and I'm a blood and cancer doctor. And today I'd like to go over ways or steps that you can take to help you prevent the development of cancer. Now, before we get into this, I'd like to go over one simple thing. In general, there are three types of patients. There are those of us who are born with good genes. I prefer to call them lucky genes. This just means that you're the typical person that smokes, drinks, and no matter what, you'll live to be 90 years old and you'll die of something else. Now, there are those of us who are born with bad genes or unlucky genes, as I prefer to call them. And this is the typical person who takes care of themselves, never smokes, does exercise, and despite all of this, develops cancer at a young age. Now, the majority of us are somewhere in between. So if you take steps to try to reduce your risk of cancer, then that will definitely impact you, because if you smoke and you're somewhere in between, that will definitely increase your risk of cancer. If you do not take care of yourself, then this could definitely increase your risk of cancer. But if you do take care of yourself, then this can definitely decrease your risk of developing cancer. So these are overall environmental factors and other little things that you can do to help reduce these risks. So let's get into these one by one. So the first thing I'd like to go over is smoking. I'm not going to spend a lot of time on this. We all know you should not smoke, and we all know that smoking increases your risk of cancer. Now, what I do want to tell you is, as an oncologist, I see, for example, lung cancer patients all the time. Smoking increases your risk of lung cancer, breast cancer, pancreas cancer, gastric cancer, esophageal cancer, bladder cancer, etc., etc., etc. So I see these patients all the time. Let's stick to the lung example. And I ask them, do you smoke or did you smoke? And they tell me, yeah, I smoked up to the time I got my diagnosis. And I said, so wait a minute, you were just diagnosed, say 3 weeks ago. That's right, doc, and I cannot see another cigarette in front of me. I quit cold turkey. And I always ask them, if smoking was so difficult, why did it take a cancer diagnosis for you to quit? And it's amazing. I can tell you that 95% of my patients tell me that it was impossible for them to quit smoking, but yet once they were given their diagnosis of cancer, they did. So the reason I'm telling you this is try not to be in that bucket of patients that it takes a cancer diagnosis to have them quit, because yes, it can happen to you. Now, the next group of patients is alcohol. Now, drinking a lot of alcohol can increase your risk of cancer at several sites. I'm not going to spend a lot of time on this. I'm not going to ask you not to drink, but if you do so, please drink in moderation. Now, the sun. We all know the sun can increase your risk of skin cancer. So try to take care of yourself. The sunblock, the long sleeve shirts, the gloves, the hats. Just know that basal cell skin cancer, squamous cell carcinoma of the skin, and the dreaded melanoma, all these types of cancer are associated with sun exposure. So please just take care of yourself from the sun. Now, exercise. A lot of people do not believe that exercise can reduce your risk of cancer, but it does. It's actually been demonstrated that a moderate amount of exercise can decrease your risk of developing cancer. Now, what is moderation? Well, usually about 30 minutes of vigorous exercise or about 1 hour of moderate intensity exercise can reduce your risk of developing cancer. Elderly patients, I usually tell them, try to do a lot of walking. A stationary bicycle is a good way of exercising, especially for the elderly, because you're less prone to falls or hurting yourself. But overall, just get out of the couch, get out of bed, and just stay active, because that can definitely reduce your risk of developing cancer. Now, diet. As the saying goes, you are what you eat. And we do know that there are certain foods or certain things that we eat that can increase your risk of cancer. Fat, for example, sugar, processed meat. Processed meat is a big one. It's horrible for you. Red meat has been linked, for example, to colon cancer. So I'm not going to tell you not to have red meat, but just do so in moderation. Another thing is increase the amount of fiber you're taking in. Increase the amount of water that you're consuming. They say that the average adult should have between 6 to 8, about 8 glasses of water a day, if not more. Now, be careful if you're a person with heart failure, because I don't want you to go into heart failure. Increase the amount of fruits and vegetables that you take in. Now, vegetables and fruit is one that I worry about pesticides. So make sure you wash your fruit and vegetables. If you find a soft bristle brush, maybe you can clean your fruits with, your apples, etc. The whole idea here is you do not want to start this very healthy diet and at the same time ruining it by consuming all these pesticides that these fruit and vegetables may have. So make sure they're thoroughly washed. The next thing we're going to go into is obesity. And that's right, fatty tissue can increase your risk of cancer. And it just makes sense. If you have a healthy diet, if you exercise, you're going to lose weight. And that also helps you reduce the risk of cancer by not being obese. I'll just give you one example by which obesity can increase your cancer risk. The fatty tissue can increase the amount of estrogen in your body. So obesity can increase your risk of breast cancer, especially in women. So that's just one simple example as to how obesity can lead to cancer. So again, if you live a healthy life, you lose weight, you're at a healthy weight, that will be better for you. And not only that, you're going to feel better and you're going to look better. So now we're going to get into the HPV virus. This is the human papilloma virus. This is a sexually transmitted disease. Now, the crazy thing about this is if you acquire this virus, this can increase your risk of head and neck cancer. So cancer in the tongue or the base of the tongue, anywhere in this region of the head and the neck. It can also increase your risk of cervical cancer, and it can increase your risk of anal cancer. It's usually a type of cancer that's called a squamous cell carcinoma, and these sites that I just mentioned are typical of developing squamous cell carcinoma. And again, it is a sexually transmitted disease, so use caution out there and be careful not to acquire the virus in the first place. Just know, and this is what I want you to know, not all HPV viruses cause cancer. The majority of them don't, but there are a few HPV strains that can cause cancer. So if you can, try to avoid getting the virus in the first place. And the other thing that I want you to know is that there is a vaccine out there that you can receive, especially young adults and children. So just inquire about this with your physician. Ask your physician or your pediatrician to see if you or your child is a candidate for the HPV vaccine. So now we're going to get into screening. Now I can tell you this is a very important topic because these are steps that we can take to try to prevent you from developing cancer or detecting the cancer a lot earlier. The first one I want to go over is the mammogram. So this is for women. It's also done in men on occasion, but overall this is for women. And all this is a picture. It's an x-ray of the breast. The amount of radiation that you obtain is very, very minimal. So something you do not need to worry about. And all this does is that it tries to detect cancer at an earlier stage. It does not prevent you from developing cancer, but if you have cancer, it tries to find this cancer earlier on and therefore giving you a better chance at survival. Now, we use the mammogram by, for example, it gives us this picture, and if you have an abnormal appearing area, the mammogram by itself is not going to tell you if there is or if there isn't cancer. It's just going to tell you if you have an area that does not look normal. And if that's the case, then we have a few options. Number one, we can get a deeper mammogram. It's called a diagnostic mammogram. Or we can have an ultrasound or a sonogram, same thing. Or we can do an actual biopsy by which we obtain a little piece of tissue with using a needle. And then we send this tissue to get analyzed and it'll tell us if there is or if there isn't cancer. So just know the average mammogram starts at around the age of 40. Now, if you have a strong family history, ask your physician because you may be a candidate for a mammogram at a younger age. Now, the next thing is a colonoscopy. So this is for everybody, men and women. Colon cancer is very common. It's one of the most common causes of cancer death. So this is something a gastroenterologist performs. It's basically a camera will go in your rectum and view your entire colon or the large intestine. Now, the colonoscopy has overall two functions. Number one, it can detect cancer if you have one. And number two, it can detect a precancerous lesion. So every colon cancer starts off as a polyp. So if you have a colonoscopy and they go in with this camera and they find this polyp and it's removed, then that polyp will not become cancer. So very, very important that we all have our colonoscopies. The colonoscopy usually is started at around the age of 45, unless you have a very strong family history of colon cancer. In those cases, you may be a candidate for a colonoscopy at a younger age. So ask your physician if it's time for you to have your colonoscopy. Now, the next colonoscopy you have, so your colonoscopy number 2 or number 3, it all depends on what they found on your first colonoscopy. So if you had a ton of polyps or if you had a bunch of suspicious lesions, then they may perform a colonoscopy on you within the first year. Now, if your colonoscopy was completely clean, then you may be due for your next colonoscopy multiple years later. So ask your doctor to see when you are due for a colonoscopy. All right, now we're going to talk about the PSA or the prostate-specific antigen. Now, guys, we're born with a prostate. This is a problem. The good news is that not all prostate cancers will kill you. A lot of them are pretty indolent. They're not very aggressive. Now, others are. And there's a very good chance that if you have prostate cancer, there's a chance that you will die with prostate cancer and not because of prostate cancer. And one of the reasons is that we have the PSA and the digital rectal exam. So I know that none of us want to have this test done, the digital rectal exam, but it's very important for various reasons. Number one, if we feel an abnormal prostate, then that will prompt us to do further testing. And number two, not all prostate cancers produce PSA. That's right. Although the majority do. So that's why it's important for the PSA and the digital rectal exam. Now, the PSA, just because it's elevated does not mean you have prostate cancer. Things like BPH or benign prostatic hypertrophy, which is just simple swelling of the prostate, may elevate your PSA. Now, if your PSA is very high, say greater than 20, then definitely there's a high chance that you may have prostate cancer. And in these cases, if you have an abnormal digital rectal exam or an abnormal PSA, or we suspect you have prostate cancer, then we'll likely move on towards a prostate biopsy to confirm or let us know that you do not, or you do have prostate cancer. Now, the pap smear. Ladies, you know all about this. The risk of cervical cancer is quite high worldwide. And this is a procedure that we do to look, number one, to see if you have cervical cancer. Number two, could you have pre-cancer? And remember when we spoke about the HPV virus? Well, with the pap smear, we can also find the HPV virus. So if you do have the HPV virus, then we already know that you may be at a higher risk of developing cervical cancer, and we can follow you a little bit closer. Now, the pap smears are usually done at around the age of 21 or at the time that you become sexually active. So just something for you to keep in mind. Now, the last thing I want to go over is for smokers or people who are at high risk of lung cancer. And that is by using a low dose CT or low dose CAT scan. So if you're a smoker, or if you quit smoking within the last 15 years, then you may be a candidate for a low-dose CT scan. And what this does is that it basically looks at your lungs and it lets us know if you have something suspicious that could be cancer. Again, just like the mammogram, it's not going to tell you if you do or if you don't have cancer, but it can prompt us as to you have something abnormal. Let's take steps, especially since you're a smoker, you're at a higher risk of having or developing lung cancer, so you may need a biopsy. That's all it does. The low dose simply means that it's a special type of scan that does not give off so much radiation. It's a very small dose of radiation. So we don't want to do CAT scans unless it's absolutely necessary. And if we can get by with a CT scan with a little bit of radiation, then the benefit will definitely outweigh the risk. So that's it. Keep these steps in mind and live a healthy life. And I hope that I'm able to help someone out. If you like, please subscribe. I'm going to come out with a whole bunch of content that you may find not only entertaining, useful, and educational. Thank you.